Diabetes mellitus Part 2. Screening for diabetes. It's important to understand the symptoms of diabetes, which are increased thirst, increased urination, dry mouth or skin, tiredness or fatigue, blurred vision, slow healing of cuts and sores, unexplained weight loss, frequent infections of the skin, gums, or urinary tract. And the American Diabetes Association recommends that all individuals should be tested for diabetes by age 45. If the test is normal, they should be retested every 3 years. And they should be screened more frequently or at earlier ages if they're obese, has a family history of diabetes, are African American, Hispanic, Native American, or Asian, delivered a baby more than 9 pounds, had gestational diabetes, have an elevated HDL cholesterol, screen at earlier ages and test more frequently if obese, has family history of diabetes, are African American, Hispanic, Native American, or Asian, delivered a baby more than 9 pounds, a gestational diabetic, has HDL cholesterol levels less than or equal to 35 milligrams per deciliter, has triglycerides greater than or equal to 250 milligrams per deciliter, have hypertension, and previously tested with impaired glucose levels. Fasting blood glucose is very commonly done during annual exams with blood work. A normal level is less than 100, prediabetes 100 to 125, and diabetes 126 or higher. Hemoglobin A1C is used for people who are already diagnosed with diabetes to make sure that we can keep them under control. It shows a person's average blood sugar levels over the past 2 to 3 months and shows how well blood sugar is being controlled over time. It is used in conjunction with home blood glucose monitoring to make adjustments in diabetes medications. Hemoglobin A1C, normal less than 5.7%, prediabetes 5.7 to 6.4%, and diabetes 6.5% or higher. For non-diabetics, the normal range for the A1C test is between 4 to 6%, and the goal for diabetics is an A1C less than 7%, and the higher the hemoglobin A1C, the higher the risk of developing complications related to diabetes. And diabetics should have this test every 3 months to see if they have reached their control target. Complications of diabetes. It's important to understand the long-term complications. And I believe that diabetes is one of the most underestimated disease. I think it's a vicious disease. And I have several family members who have diabetes, including those who've had amputations as a result of diabetes. Atherosclerosis and kidney disease are the main killers of diabetics. Vision or small blood vessels develop issues. Blindness. Number one cause of blindness in the US is diabetes. And diabetics also have increased risk for developing glaucoma and cataracts. Macrovascular or large blood vessels, heart disease, stroke, and hypertension, neuropathy, which involves the breakdown of peripheral nerves, so erectile dysfunction or impotence in men, and gangrene, and that develops in the lower extremities, especially those toes, but can also happen in fingers. There's decreased nerve sensitivity, and so because of the breakdown of the peripheral nerves, you're not getting adequate blood flow to those areas of your body, let's say the toes, and then after a while, some necrosis or cell death begin to set in, and gangrene can be an issue, especially if they have a wound in their feet that just will not heal. And this is the reason why amputation is so common among diabetics. Nephropathy of the small blood vessels, kidney failure, and if you were to visit a dialysis unit, the majority of people in that dialysis unit are probably diabetics. Infections, osteopenia, bone and joint pain. Now, I want to spend a little bit of time trying to explain this chart, this flow chart. Now, we are making an assumption here of some type of insulin deficiency, and this is worst case scenario, and all of these are not necessarily happening at the same time, but just to get an idea of what's going on. So if the body perceives that there's an insulin deficiency, now there could be enough insulin being made, but just that the body is not recognizing it, and there is a decreased uptake of the cells of the glucose. This leads to hyperglycemia, buildup of the sugar in the blood, and because the sugar has to have a place to go, it eventually spills over into the urine, and through the process of osmotic diuresis, it's going from an area of high concentration to low concentration, and you have water and electrolyte loss. And then here it leads to cellular dehydration and impaired renal function. All of these different processes are going to be working the kidney very hard. Now let's move to this side of the diagram. Again, the body is trying very much to survive, and it can make new glucose through the process of gluconeogenesis by breaking down amino acids. Now, this means that the amino acids that are being broken down are coming from your muscles, and this can cause that unexpected weight loss that we see in some diabetics. So amino acid broken down, converted into new glucose, but because there's decreased uptake, we have hyperglycemia, glucosuria, diuresis, and overwork of the kidneys. But another process is also taking place here. You may remember that protein is the only nutrient with a nitrogen ring, and nitrogen is very hard in the kidney. So all of this extra nitrogen has to go somewhere. So it is being excreted and being processed by the kidney. And the kidney really doesn't like all of that nitrogen. Again, leading to some cellular dehydration and impaired renal function. We go over now to this part of the chart, increased free fatty acid release. So the body's like, whoa, you know what? There's a lot of body fat, and I'm going to take some of that and I'm going to break it down to make new glucose because the body really needs it. And you can see here, new glucose is being made from free fatty acids. And again, this new glucose, because the body is not recognizing it and using it efficiently, will lead to hyperglycemia. All of this extra blood sugar has to go somewhere, so it spills over into the urine, And then, because of osmotic diuresis, the water and the electrolytes are being pulled, causing cellular dehydration, that increased thirst that happens all the time, the increased urination, and impaired renal function. But along with breaking up all of this extra fat, some of that fat that's just being broken down is also going through the arteries and building up, causing plaque, narrowing of the arteries, and that is another reason why heart disease is such a big killer of diabetics. But moving along here, all of this free fatty acid being broken down now leads to increase in ketogenesis. More ketones are being used. The body says, I love glucose, and the body needs glucose for energy. But some body cells can use some ketones for a few days, but not the brain. As you increase your ketogenesis, again, ketones have to be flushed and go somewhere. And again, kidneys being overworked, causing cellular dehydration. Increased ketogenesis will lead to ketoacidosis because the brain cannot use ketones for its processes. Eventually, over time, this can cause coma and cell and even death of the person, not just the cells. So you'll hear someone went into a diabetic coma. This is what's happening here. Treatment of diabetes. Type 1 diabetes, again, primarily children, teens, and young adults are being diagnosed with type 1 diabetes. They need insulin because the body is not making the insulin they need. So we also then have to focus on diet. And we have some resistance here with children and teens, and for sure, young college kids who are eating just about anything they want to when they feel like it. But we really have to emphasize the importance of regulating the diet and exercise. With type 2 diabetes, we go first with diet and exercise. Hi, can we put you on a lifestyle modification where we change your diet and get you to exercise more? And a lot of people, their diabetes can be under control. If people are pre-diabetic, they don't have to develop diabetes necessarily if they are committed to a lifestyle change that involves monitoring their diet, especially the sugar, all of the unnecessary carbs from white bread and pasta and those type of things that will increase their blood sugar. Now, if the lifestyle, diet, and exercise isn't working, we may then have to have an oral hypoglycemic medication added. This is usually a small pill. And if that doesn't work, then we have to put them on insulin. With proper education and within the context of healthy eating, a person with diabetes can eat just about anything a non-diabetic person eats. Patients are taught how many total grams of carbohydrates, fat, and protein they can eat throughout the day and still keep their blood sugars under good control. And they're given a meal plan budget, and then they decide how to spend it at each meal. Diabetics are at high risk for heart disease, so the diet also needs to be relatively low in fat. With the diet, a main focus is on portion control, understanding serving sizes, and the meal plan is designed so that the carbohydrate content is consistent throughout the day. And again, emphasizing diabetics need to follow physical activity guidelines to balance energy intake with energy output. And so the benefits of physical activity really, really helps with diabetes. Lowers the blood sugar and improves the body's ability to use glucose. decreases the amount of insulin needed, reverses the resistance to insulin by increasing the number of insulin receptors, helps with weight control, decreases the risk for heart disease by decreasing LDLs and cholesterol and increasing HDLs. And when combined with a meal plan, it has the ability to control type 2 diabetes without the need for other medication. Let's spend a few minutes talking about the glycemic index and glycemic load because they can be important tools for helping to control diabetes. The glycemic index and glycemic loads offer information about how foods affect blood sugar and insulin. The lower a food's glycemic index or glycemic load, the less it affects blood sugar and insulin levels. And there are lists of foods that actually will show you what the glycemic index and the glycemic load is. Sometimes you can just, type that in and, you can get that easily on the web. Glycemic index measures a person's glucose response to a carbohydrate-containing food independent of the number of carbohydrate grams in a portion of food. And the glycemic index is lowest for foods that raise blood glucose slowly because they're slowly digested and absorbed. So we're talking a lot about foods that are high in fiber. The problem with the glycemic index is that the portion size of the test food contains 50 grams of absorbable carbohydrate. Not very realistic. However, with some foods, the portion of the food that contains 50 grams of carbs does not represent an average portion. So, for example, 50 grams of carrots is used as a standard, and that's about 1.5 pounds. And the glycemic loads takes the portion size into consideration. And the glycemic index for glucose is 100, and this is used as a reference. So again, you can search for the glycemic index and the glycemic load for certain foods, and usually there is a list of foods that is very handy for your reference.